Hi, this video is the art of hair transplant restoration surgery on a client who has a class 6 hair loss pattern leading from the front toward the back. He had a hair transplant done in the past, supposedly covered from the front all the way toward the back. I ventured to guess they were attempting to do around 4,000 grafts, but as you can see, hardly any hair grow. Hair transplant is really dependent on the surgical skill of the surgeon, of course in the clinic too. This is different from one clinic to another, and the result different from one surgeon to another. So it's very important that when you do the surgery, you have to select the surgeon who produce quite a bit of the result. And it's not what accolade or the diploma they have on the wall, it's what the clinic or the surgeon show how much the before and after the result is. They boil down the result. And you can see this is not a very good growth, very poor density. And my goal today is to do at least 4,500 grafts. We will transplant from the front all the way toward the back. It will completely transform his look. I mean, it will look different for sure a year later with better density. Due to the fact that he had a procedure done in the past, I'm not certain that I can get 4,500 with the strip method. He already had a strip done before, so we just do the same. But we'll try our best. Whatever we can get out, we will give him, again, from the front half toward the back. And the more we do, the better the density he will have. Hair transplant, not just the surgical skill of the surgeon, as I'm emphasized quite often, it is the artistry behind it too as well. The surgical skill will produce the density. The artistic and aesthetic detail will really allow you to have a very natural look and hairline, because you want to walk down the street where, as if no one knows you have had surgery. And with my work, it's very natural. I'm not going to give you an extremely high hairline where you still look bald and a big forehead, or too low where you look like a kid. The goal has always been, if you have the hairline should be, if you have no hair loss, what is the most natural and highest hairline you're supposed to have? And that's what our goal is. And again, the more narrow the face, the more arched back the hairline is, the more round the face, the more flat the hairline is. The average height of the hairline from the mid-eyebrow to the hairline is around 6.5 to 7 for Asian, and black and Caucasian is around 7.5 to 8.5. And no hairline straight, so we zigzag through. And then once we get the shape down, we'll transplant at 45, 45 in the front. Increases when you go backward and changes when you go a different direction. The goal in the front is always softness and naturalness, so we transplant rows and rows single hair graft in the front. We go in the back for its volume and density, so we transplant larger root. So the selection of hair grafts is important. That's why we transplant soft, small root in the front with a bigger root in the back. So this is the art of hair transplant restoration surgery, and we'll be attempting at least 4,500 grafts today. Thank you.